Hi there, I'm Dr. Rose, and if you're watching this video, chances are you're a lot like many of the men I've met over the past 20 years as a doctor. Strong, experienced, you've been through a lot, but every now and then, yeah, you feel like something inside you is starting to quiet down. Not gone, just not as clear, not as alive as it used to be. Let me invite you to imagine something for a moment. It's a quiet morning. You're sitting in your favorite chair on the porch, a warm cup of coffee in hand. The breeze brushes across your skin. You look out, and suddenly this thought comes up. Am I still me? Am I still the man I was in my 30s, full of fire, full of life? If you've ever had a moment like that, you're not alone. I've heard that story in so many different ways, from patients, from friends, even from my own brother. They don't shout it, they don't say it out loud. But in their eyes, I see it, that quiet ache, that silent question. As the body changes, am I still valuable? And I want to tell you something clearly and with all my heart, your body is not betraying you. It's evolving. It's speaking to you in a new language, one that says, listen to me differently now. Today, I want to invite you into a different kind of conversation, not about illness, but about aliveness, the kind that makes you feel like you're not just surviving, but truly living. And I want to start with a simple truth. Men's health in older age isn't just about your heart, your blood pressure, or your prostate. It's also about the things no one talks about, your emotions, your connection, your physical joy. The parts of being human that society tells you to silence, to accept aging, and just let go. But why should you let go? Why can't you live more fully, more truthfully, especially now when you carry a lifetime of wisdom with you? One of my patients, Tom, 72 years old, once told me he felt like his flame had gone out. No desire, no intimacy with his wife. He figured, well, I guess that's just age. But after many conversations and rediscovering gentle, curious touch, Tom began to realize the issue wasn't about getting hard. It was about reconnecting with himself, something he had forgotten. Did you know this? A 2016 study in the Journal of Sexual Medicine found that pleasure and erections are two completely separate systems. That means even if your erections aren't the same, you can still feel enjoy and deeply connect with your body. And the moment you accept that truth is the moment you start to feel free again. Not loud chest beating freedom, but quiet liberation from pressure, from the idea that you have to be strong, from the fear that you're no longer man enough, you're not getting weaker, you're stepping into a new chapter one where curiosity, gentleness, and honesty with yourself mean more than performance ever did. I'm not here to tell you how to live. I'm just here to remind you of something important. You are still worthy of being touched with kindness. You're still worthy of feeling alive, not just breathing, but truly alive. And that is where our journey begins today. Together, we'll explore 5 secrets to men's health in older age. Not to chase youth, but to live more fully right now, with presence, with gratitude, and with just a little courage to listen to yourself again. I'm Dr. Rose, and I'm so glad to be here with you. Now, let's begin. Have you ever felt this way, lying in the dark, still and quiet, and suddenly wondering, why doesn't my body respond like it used to? Maybe it's not reacting the way you hoped. Maybe you feel confused, embarrassed, even ashamed. If that feels familiar, I want you to hear this. You are not broken. You are not alone. Your body isn't failing you, it's shifting. It's inviting you into a deeper, more intimate relationship with yourself. I once worked with a man named Tom, 72 years old, who believed his intimate life was over. But something beautiful happened. When he started listening to his body, not with pressure, but with soft curiosity, he began to feel things he thought were gone. A 2016 study backed up what I see in my clinic every day. Satisfaction and erection are two different things. You can still experience pleasure, connection, intimacy, even if performance isn't what it once was. Try this sometime. Next time you're alone, let go of expectations. Don't focus on what should happen. Just follow your curiosity. Notice your breath, your skin, not to achieve anything, but just to be present with yourself. Gently. You haven't lost your manhood. You're just entering a new stage one where connection comes from the heart, not from pressure. You're not declining, you're evolving. And that, yay, is a beauty you absolutely deserve to enjoy. If you're ready in the next part, I'll talk with you about something deeply misunderstood masturbation and why it can be a true gift for your mind and soul. I know this is one of those topics that many men find hard to talk about. Masturbation, just one small word, but it can carry so many heavy emotions, shame, awkwardness, embarrassment, especially after we've passed the age of 50. But today, I want to invite you to look at it from a completely different perspective. I once had a patient, he lived alone after his wife passed. He wasn't physically close to anyone anymore. And over time, he even stopped touching himself. He told me maybe I'm just too old now, and it doesn't matter anymore. But after a long, honest conversation, I looked him in the eye and said, no, this isn't something you need to give up. It's actually one of the ways you can come back home to yourself. You see, when masturbation is done with awareness and kindness, it's not just a physical act, it becomes emotional therapy. A 2018 study found that sexual activity, even solo, releases oxytocin and dopamine. These are the body's natural feel good chemicals. They reduce stress, ease depression, and can even help you sleep better. For many of my patients, it's like hitting a reset button at the end of a long day, a way to soften the loneliness, to remind themselves that they're still a living, feeling worthy human being. But here's the key: do it with intention, not to escape, not in a rush, but to reconnect. Create a space just for you, maybe some soft music, a warm bath, a few deep breaths. And ask yourself, what am I truly feeling right now? You don't need to prove anything to anyone. Just remember this: touching yourself isn't just instinct, it can be an act of self respect. You deserve to feel whole physically, emotionally, and spiritually. When understood with the right mindset, masturbation doesn't make you weaker. It helps you return to yourself. In the next part, I'll talk about why simply stopping isn't the answer and why keeping that connection with your body matters now more than ever. I'll see you there. There's something I often say to my older patients. It usually makes them chuckle, but then they pause and nod in agreement. The body is like a musical instrument. If you stop playing it, it goes quiet. And when it comes to sexuality, that's especially true. I once met James, a kind, well mannered man, 68 years old. He used to be a PE teacher. After his wife passed away, he completely disconnected from his body. No touch, no feelings. It was like everything inside had shut down. After years of that, he told me, Rose, I want to come back to myself, but I'm afraid it's too late. But you know what? It's never too late. Your body just needs to be gently awakened again. A 2020 study published in the Journal of Urology showed that keeping up sexual activity, even solo, improves blood circulation, keeps penile tissue healthy, and lowers the risk of age-related erectile dysfunction. When you stop completely, those tiny blood vessels can slowly tighten. The nerves become less responsive, but with even just a little regular, gentle stimulation, the body starts to remember. Just like a muscle, if you stop using it, it weakens, but if you gently train it again, it can come back to life. I told James, don't make it a goal to succeed. Just give yourself one quiet evening to touch your body, not to perform, just to reintroduce yourself. And little by little, he began to feel again. Not just sensation, but also aliveness, confidence. You don't need to do this for anyone else. Do it for you, because you deserve to feel alive, present, and connected. Start small, maybe once a week. Listen to your body, be gentle, be kind, like watering a part of the garden that's been forgotten. This isn't just about sex, it's about coming back to your body and not losing that sacred connection. In the next part, we'll talk about something that seems harmless, but could be silently numbing your sensitivity: overuse of pornography. So stay with me because you deserve to feel truly alive. I want to tell you this gently but honestly. It might not be easy to hear, but I believe you're brave enough to face it. Pornography isn't the enemy, but when we rely on it too much, we start losing something incredibly valuable: our real sensitivity, especially to our own body. I once worked with a patient, Robert, 66 years old, divorced for a few years. He told me, I don't feel anything anymore when someone touches me or when I touch them. I only get aroused when watching porn. And then he said softly, but afterward, I just feel empty. And Robert's not alone. A 2019 study in Neuroscience and Biobehavioral Reviews found that frequent porn use raises your brain's stimulation threshold, meaning you start needing more stronger and weirder content just to feel interested. But the cost, you slowly lose the ability to feel real human connection through a gaze, a familiar touch, or the quiet presence of someone close. Your body, whether you're 60 or 70, still holds deep emotional potential, but when it's constantly overstimulated by artificial images, it starts forgetting how to listen to itself. So I guided Robert through a simple screen detox, no guilt, no judgment, just small steps like reconnecting with imagination or noticing what it feels like when your own hand brushes your skin or the quiet of a room or a long exhale. And here's the amazing part. After a few weeks, Robert came back and said, I feel alive again. Not rushed, not fake, just real. I'm not here to say you must quit porn entirely. I'm simply inviting you to create some space for your real feelings to return. Try turning off the screen for just 1 week. Place your hand over your heart and ask, what do I actually need? You might be surprised by the answer. In the final part, I'll share why masturbation, when understood correctly, isn't just a physical act. It's a superpower that helps protect your health, your identity, and your sense of self-worth. Let's finish this journey together because you deserve that. I know there's been a lot said about masturbation, right, wrong, should, shouldn't, but today I want you to hear something not from dogma or shame, but from a doctor who's worked for decades with men over 50. Masturbation done with care and intention is a superpower for your health. Not just physical health, your mind, your sense of identity, your emotional strength, too. A 2021 study in The Gerontologist showed that regular masturbation supports prostate health, improves sleep, and helps ease feelings of loneliness, especially in widowed or single older men. But the thing I care about most, it's not the statistics. It's the moment I see in my patients' eyes when they reconnect with themselves. Henry Care once told me, after my wife passed, I felt like touching my body was wrong. I stopped feeling like myself. So we started with simple, gentle conversations, no pressure, no goals, just helping him understand touching yourself isn't indulgent. It's an act of self-respect. Months later, Henry came back. His eyes lit up. He said, I feel like myself again. You see, masturbation isn't just release. It's a way to remind yourself you're still alive. You still deserve to feel. You still matter no matter your age, like a nourishing meal, a peaceful walk, or your favorite music. Masturbation can be part of your self-care. No shame, no hiding. Just do it with presence, gratitude, and a little tenderness, because you deserve to feel whole, not just alive, but truly living. Dear friend, if you've made it all the way here, I want you to know this. You just did something beautiful for yourself. Not everyone is willing to listen to their body with curiosity, with compassion. Not everyone dares to question the silence, the old beliefs, and ask, what do I truly need to feel alive? But you did, and that matters. It shows that you're still choosing aliveness, not just existence. This journey isn't just about sexuality or physical health. It's about coming home to yourself through every breath, every gentle touch, every moment you allow yourself to fully feel. You are not fading. You are becoming more refined, more free, like a slow, soulful piece of music. And I want to remind you of this. You are still worthy of love, worthy of being touched, worthy of living every moment of your later years with pride and fullness. If something in this video resonated with you, leave a comment below. I read every one. And you never know, your story might be the light someone else needs in a moment of loneliness. If you found this helpful, don't forget to hit like, subscribe, and share this video with a friend. It might be the gift they didn't know they needed. What would you like me to talk about next? The prostate grief after losing a partner, or how to rebuild intimacy with the one you love? Let me know, because this channel isn't just mine. It's ours. I'm Dr. Rose, and I'll always be here. As a companion, a gentle reminder that you have never lost your worth, and you always deserve to live fully. See you in the next video.